The Memorial Health System is located in Southwest Florida. We're a large system composed of 6 hospitals. 2 of our acute care hospitals are specialty hospitals, a rehab hospital and a children's hospital. We are one of the largest not-for-profit organizations in Florida. Before we went with ZynxCare, our care planning process was very siloed. Each discipline used their own care planning process, a different language, a different way, whether it was on paper or even different sections within the clinical documentation system.
Some of the issues that occurred when you're in a silo-based culture and providing care is you have all your disciplines who are all part of the care team for a single patient, but the communication between each of those disciplines becomes either very, very brief or not at all.
I believe that prior to being an interdisciplinary team, our staff didn't understand each other quite as well. And you would have an occupational therapist come into the bedside, work with the patient, and a nurse is not being fully aware of what the occupational therapist is doing. And the nurse may end up coming into the room and not repeating exactly what the occupational therapist wanted and what they ordered.
One discipline, like therapy, might bring the patient and get them to a specific goal, and they've reached that goal and the patient's ready for discharge. But that goal being reached was not translated or discussed with the nurse. So the patient may have to stay an extra day or may not be discharged in a timely fashion. That's going to increase your length of stay, increase costs, and actually decreases your patient satisfaction.
We went on a search for third-party content, and Zynx was one of the vendors that we investigated, and we did a cross-comparison. We had a rigorous selection process that we used as we evaluated and investigated the different third-party content vendors. We liked the frequency of the scientific updates, the availability of the science as you're making your build and design decisions, and that science then was available to the user as well at the point of care.
Zynx Healthcare and their plans of care have really helped us launch a lot of our strategies in the fact that their templates have assisted us in looking at what the evidence tells us needs to be in place for different patient problems, different goals, and the interventions that are related to those goals. ZynxCare also helped us to realize that it's not about nursing, it's about all the disciplines. So let's not start off with just nursing diagnoses as we did years ago, which nurses don't even use any longer most of the time, but to look at what the patient's problem really is and what is necessary to get that patient's care as best as we can get it and get them out of the hospital as quickly as we can.
The patients do acknowledge that there is better communication among their healthcare providers. You are their team, they trust you, and it makes it so much more effective when you can all speak the same language.
And we're really realizing the true collaborative effort that we've missed out on all these years, because now we're at the table together, speaking the same language and developing the patient's plan of care.